I'm from a rural area of Missouri. Growing up, I saw a lot of the disparities and difficulty accessing care for patients in that small town, oftentimes having to drive 2 hours to the nearest big city to get specialty care. Those experiences early on drew me to rural medicine, and that's why I ultimately chose the rural health equity track through UW Family Medicine. And with this rural health equity track, I am able to do a lot of rural focused rotations. I was able to rotate at the Menominee Tribal Clinic as well as Baraboo, Sauk, and Dodgeville. And so I've been able to experience a lot of different small towns and kind of experience what those hospitals and clinics are like because that's what I'm going to be doing in my future practice as well. One of the nice things about this rotation in Sauk is, although it is rural, it's only a 35-minute drive from where I live in the Madison area. So I really enjoy that aspect of being able to still live in Madison and then being able to drive into a rural area that's relatively close by. When I arrive at the hospital, the first thing I do is check in with my attending physician, Dr. Bathke, to kind of see what the plan is for the day, whether we have cases in the OR or if we have patients to round on or if we're just starting out in clinic. So here at the Women's Health Clinic is where I spend the majority of my time this rotation. And this is basically whenever I'm not in the operating room or not seeing labor patients or rounding on patients, I'll be here in the clinic. So I work primarily with Dr. Bathke, supervising OBGYN. She has a lot of interesting cases, very experienced physician. I spend some other time also working with her midwife and her physician assistant if they have, kind of interesting procedures or ultrasounds, different things like that. My schedule for the birthing center depends on the day. Sometimes I'll come to the birthing center first thing in the morning when I arrive at the hospital around 7:30 or 8 if we have someone who's already in labor or if we had an induction from earlier in the morning. Other times we'll go to clinic or the OR first. We might come in like on a weekend if we have someone who's in active labor who is going to deliver soon. One of the best aspects of doing rural rotations is the continuity of care that you're able to see. And one of the great things about family medicine and rural family medicine in particular is getting to follow the patient. So, I'll see the mother during her pregnancy with the prenatal care, maybe get to be at the delivery, and then maybe even get to care for the baby afterward. One of the biggest differences between working in rural hospitals versus urban hospitals is the number of residents and other learners. And so it's more one-on-one experience working with just myself and an attending physician versus at a larger academic institution, there's usually a much larger team. And so you get to work with the same person over a longer period of time and get to know them more personally. At the tribal clinic, for example, one of the attendings invited me to her house and I got to know her and her husband and her kids and go kayaking with them and different things like that. In family medicine, we do obstetrics, and that's one of the more rewarding aspects. There are certain clinics, like where I'll be working in the future, where there are no OBGYNs, and so it's all on us. And so it's really a good experience to work with more OBGYNs now and kind of gain that experience before I'm out on my own when I won't have as much assistance from them in the future. One of the benefits of doing a rural OB rotation as a family medicine resident is that I get to work one-on-one with OBGYNs who have a lot of experience in doing high-risk deliveries and been practicing obstetrics for a very long time. I feel these rotations are preparing me very well for my rural practice. The easiest example is that I've rotated at the Menominee Tribal Clinic where I plan to practice twice now. I'm familiar with the hospital and the layout and the structure of the call schedule, and I know what to expect from working there. The aspect of rotating at a hospital first before signing a contract there, I feel like that's a really great benefit of the rural health equity track and something that many of our graduates have done, the vast majority of them actually. So I chose to work at a tribal clinic because it's a very underserved population that is always in need of more physicians to go to those areas. The majority of tribes are in rural areas, so it's kind of a great way to blend my passion for rural family medicine with working with specific rural underserved populations. The advice I would give to medical students looking at rural residencies would be to get experience doing rural rotations in medical school. I think that gives a good experience of what to expect when you would be going into a rural residency. I think it's also important to understand the differences between rural training tracks, like in Baraboo, where they're predominantly at a rural rotation, versus things like the rural health equity track at Belleville, where it's more of a mix of urban and rural. I recommend a rural residency program for medical students interested in going into any specialty, but I think family medicine is one of the best opportunities for that just because of the opportunity to do full spectrum, getting to work in a hospital where there often aren't a lot of other specialties and where there's a great deal of continuity of care than there are sometimes in the more urban settings.